like to know, during our discussions, we have, you have shared some of the things like which you'll be seeing as new materials, new products, something new we are going to see in the healthcare space, in the interiors, for real good reasons.
Hello everyone, thanks for having me over. In terms of what you're saying with regards to products, I'd like to touch two things really, because when we're talking about engineering and construction, there's one, the constructing part of it, and then there is the asset intelligence part of it. Dr. Lal and Harish both have said that technology is getting embedded into every parts of the hospital. So first, with regards to what you've asked, Vertika, in terms of materials, and this is something that Ajay has covered as well. Even when we're building fast hospitals, it's dry, hybrid, and modular technology that's there. So there is no single answer. It's an orchestration of several technology others. So for example, when we did the hospital at Varanasi, we had steel structures. Steel structures have been around for the longest time. They are the fastest to build, and social distancing. 600,000 square feet built by 60 people only in terms of the steel structure.
How are the futuristic hospitals going to be? What, if you can tell us a little bit about the world's, some of the best facilities that I think you have also worked for one or two of them. So if you could just tell about the uniqueness of those facilities and how India can learn.
I'd like to keep this brief because I've covered a little bit on asset intelligence already, but it's a case of remote intelligence, right? You don't need people who are operating assets physically in the asset to get the intelligence and guide the on-ground people.
Akhil, you wanted to add something?
Just a quick point when we're talking about modularization of spaces, airlock lobbies is something that people don't speak about as much. Airlock lobbies have been integral to critical areas. Now these airlock lobbies need to move out of critical areas to become junctions within a healthcare facility. Because a great amount of what we're talking about, air conditioning and ventilation flexibility, can be brought by dividing the spaces with these airlock lobbies. That's it, simple point.
Thank you for adding that on. Please continue.
The principle of smart cities is about developing your neighborhoods, right? And typically, what Dr. Lal is talking about, preventive care, it comes outside of the asset class, which is healthcare. So, as a smart city or a node within a smart city, a hospital can influence all non-healthcare assets in terms of how they can improve upon preventive care in terms of testing, or just basic dissipation of information. So that's it, a little point from our end.
Wonderful. Thank you so much. And definitely moving to Akhil and Varun Sharma.
I mean, two words in those sense, speed of construction. We built a 6 lakh square feet hospital in 12 months, and it can only become faster than this. So if you want to increase capacity, it's going to be frugal innovation to get speed of construction.